Hello.
Hello, Mrs. Farquharson.
Yeah.
Hello. It's Dr. Angela here and Dr. Sarah.
Hi. Hi.
If we could just take a seat. Yeah.
I think maybe we should turn the TV off.
Oh yeah, please do that. Yeah.
Would you mind if we just turned it? Sorry. Thanks. There, that's better, isn't it? Sorry.
Now, the results of your tests have come through, Mrs. Farquharson, and I'm sorry to tell you that you have cancer of the baby.
I don't think so. I'm nearly 60.
But the complicated thing is...
The thing is, though, that the baby actually has cancer of the fetus.
Which is going to complicate things a lot.
Yeah, and I mean, well, I don't know if you want to tell her the next bit, Angela, or...
We are pretty sure these results are valid.
We're almost definitely sure.
So
I mean, the results are here.
These results speak for themselves, although they are handwritten.
Yes, but they are the results of the tests. Definitely.
We're
almost definite that these.
So
results.
unfortunately, things are gonna be a lot different for you now.
Things are gonna have to change, but we're both here to help you through this difficult time, aren't we, Angela?
Yeah, the main thing you'll notice is there won't be any cereal for breakfast, unfortunately.
Or chocolates.
It's just going to be radiation from now on. We would ask you if you do need to use the canteen, which
yes.
we would encourage, but please don't bring your own food into the canteen during this sad time.
We would ask you in this difficult time to refrain from using your mobile phone.
Yeah, as it does interfere with hospital equipment and medical equipment in the hospital.
We're very sorry about this.
Is that alright?
We're very sorry about this. We really are. But Angela and myself are here to help you through this difficult time. Are we, Angela?
Yeah.
I mean, the results.
I mean,
we got these results back, and well, I mean,
it's not easy.
It's always the nice people, isn't it? Isn't it, Ange?
Yeah.
It's always the nice people.
Well, yeah. I mean, unfortunately, looking at the rest of your record, it shows that it says that you wouldn't harm a fly. So you know, it does tend to happen to people who don't harm flies, or who wouldn't harm anyone else. Unfortunately, there do seem to be people who are predisposed to getting cancer of the fetus and the baby as well.
Yes.
And those other complications.
And it's so terrible. We know how terrible it is. You know, we've dealt with this many times before, and you know, the baby's so young to be having cancer of the fetus, and it just seems like there's no justice in the world sometimes.
I mean, the baby's not even born, so how can it have a say?
Yeah.
When it isn't even born.
How can it even have cancer of the fetus? But the results are there. You see.
Yeah.
There
will be, of course, a number of other things. You will lose the baby, and unfortunately, probably you will have cystemia of the lymph nodes as well, which I should just let you know about that as well.
Yes.
It's a
very bad result. It's a very bad result.
It's a bad result for yourself. It usually involves swollen,
terrible conditions,
and ill side effects of illness.
Side effects of the baby. Oh.
Yeah, no, the baby will be dead.
Yes. Sorry. You told them? Okay, sorry. Sorry, Mrs. Farquharson.
Sorry, Mrs. Farquharson.
Sorry, Mrs. Farquharson. We are deeply sorry, and we are here to help you through this difficult time.
So please give us a ring if there's anything you'd like to discuss, and do remember not to bring your own food, please, into the cafeteria.
Yeah. Or
use the phone.
Well, we would remind you to.
There are payphones in the hall.
We would remind
Mrs.
you not to
Farquharson.
use the mobile phone in the hospital areas, please.
Okay. Okay.
Okay. Well,
I think. Yeah.
Yes.
Sorry again.
Should we just double check the results before we? Just.
There's nothing wrong with the results.
Let's just double check.
I'm fairly certain these results are okay.
Yes.
Mm.
Ah, yes.
Mm.
Yes.
The results are reasonably
yes.
categorical in this
We're
case.
reasonably sure about this, I think. Yeah.
So I'm afraid that's going to be it.
Yeah.
But you know, I mean,
It's never easy to do this
there's
kind
still
of thing.
plenty of time to be really fucking positive about it.
Yeah, it's
You
not
know.
that fucking bad, really.
No,
Is
I
it?
mean,
Is it really?
no. There's still a lot of, you know, there's still a lot of pissing things that you can do between now and then. So, you know, get a grip on it.
Yeah.
Get a grip on the situation.
There's still a life to be fucking lived, Mrs. Farquharson. So, we'll bid you good eve.
Yeah. Thanks again, Mrs. Farkas.
Yeah. Thanks for your time. We're sorry to
Sorry
hear the news like this.
It's bad news. It's
Yeah.
not nice for us.
It's never nice for
bringing bad
anybody,
news to
really.
anyone. But that's our job.
Okay. Okay.
Bye.
Bye bye. Bye bye.
Take care. Bye
Bye bye.